Dear all, I already had a poor health as a child, but this was stabilized in my teenage years. When I was 12, I had surgery for hidden spina bifida and dorsal scoliosis after wearing a Boston brace 23-24 hours for a couple of years. Due to a major infection, the metal was removed prematurely and unfortunately my back collapsed again. Failed back surgery. I led a normal life until I was 30, admittedly with some limitations regarding some back pain. A rear-end collision with the car in 2013 completely changed my life, from one day to the next. Numerous diverse symptoms and complaints, all very frightening. I visited a physiotherapist for 1.5 years, and many doctors during the years. I underwent numerous examinations, but unfortunately without answers. Abnormalities were identified, but no causes found. I could function much more difficult than before. There was no improvement. 2 doctors suggested that I have Ehlers-Danlos syndrome. Ultimately, 9 years later, I had another rear-end collision with the car. The consequences were disastrous. Since then, I have been unable to function normally, and I have to lay down as much as possible. Worsened symptoms and new problems. I found and went to a geneticist who knows Ehlers-Danlos syndrome, and this was confirmed. This means that the connective tissue is not as strong as normal people. As a result, I became a member of an association without a purpose about EDS patients. A world of information and knowledge opened up for me. I came across different comorbidities that could suit me. My savings were spent to get answers and diagnosis, but I cannot pay for the solutions and the preoperative examinations, consultations, etc. However, in Belgium, an unknown and rare disease and the general idea that you cannot have multiple conditions at the same time. Unfortunately, rarities often coexist with other rarities because they cause other rarities if there is no treatment or intervention. An upright scan is not possible in Belgium or even in the Benelux. For this, I had to pay out of own pockets, and I had to go to Barcelona for the upright scan and examinations, and it was confirmed. CCI-IIA, meaning high cervical instability. It simply means my head weighs too much for my spine and neck, due to damaged ligaments. Connective tissue that eventually leads to death without intervention, sooner or later, and creates more and more problems because of the compressed brainstem, compressed jugular veins, compressed nervus vagus, etc. Those are responsible for all the processes what's going wrong in my body. In the meantime, I learned that more appropriate techniques are used in the USA during the surgery needed for EDS patients like me. I had online consultations with doctors in the USA, and they studied my extensive imaging, and the diagnosis was conclusive and clear. CCI-IIA, yes. Tethered cord, yes. Chiari malformation, last mentioned, a result of the CCI-IIA and the tethered cord, both pulling my cerebellum into the spinal cord canal. Unfortunately, without medical intervention of the CCI-IIA and the tethered cord, this will go wrong. Because of these conditions, I just learned that I have, due to intracranial hypertension because of the compressed jugular veins and above, I now also have intracranial hypotension. This means because of high CSF pressure in the brain and spinal cord, there is a CSF leak. This is not good news if there is no medical intervention. Probably I will have to see an end doctor too for these jugular veins. At the moment, I know for sure I need 2 surgeries. The rest of the implications needs to be examined on an in-person visit, but I cannot get there. People have really a significant improvement in quality of life after surgery. You understand, I really want help because this is not going away by itself. I am really sick and trying to get help abroad in order to live again. And it's urgent. In Belgium, I cannot get medical help because of no expertise and no financial intervention for help in foreign countries. I really feel let down. Everybody gets medical help from the social security system in Belgium, except when it's rare and unknown, as my case, and certainly not for planned interventions. I really want to thank Mr. Brian Healy, President of the JANZ Corporation, to give me hope and attention in these difficult times. And I want to thank you for listening to my story. Greetings, Melissa from Belgium.